Morning, Redstone Arsenal. It's Colonel Smith. This morning we are going to do our best to perform a community town hall for you. Before we get started, I'd like to go through kind of how we are going to run our first virtual community town hall. First and foremost, I recognize that gatherings of large numbers of people, greater than 6, is something we are to do our best to avoid. So you'll notice gathered in this large room, we've made sure that we are getting our 6 feet between people. But I have called together those persons that could best help us to answer your questions. And the only way for us to pull those people together is in a room this big, and then that's why we're using virtual capabilities. What I'll ask you to do is, we've already asked you over the past 3 days to help us populate the questions that you'd like us to answer. So we're going to answer the questions that have come up most as trends, and I'll point to, or I'll let you see an individual best answer your question. I certainly appreciate any of the questions that you'll post in the messaging boards. We will pull those together as trending questions and either get the opportunity to answer them today, or we will continue to answer those, collect those questions through Friday and continue to answer them on our frequently asked questions page. We only have an hour today, so we'll get through what we can get through, and then we will make sure that we're posting the answers back to our forward-facing website or our public-facing website and the Facebook stream. Before I get going, I hope most of you joined us yesterday at 1400 on Facebook Live for the change of responsibility between Sergeant Major Counts and our new Sergeant Major Jimenez, who's sitting here to my left. And before we get going, I'm going to give him an opportunity to introduce himself to all of you. He is your new Sergeant Major, so please welcome him. Sergeant Major.
Good morning, Team Redstone. I am honored and excited to be your Command Sergeant Major. I'm looking forward to continue to work with the community and our partners here on Redstone as we conducted our transition yesterday. I'm coming from Fort Hood, Texas. I'm an air defender by trade. My family and I are excited to continue to build on Team Redstone. Yesterday was an outstanding change of responsibility, as most of you might have tuned in, like the Colonel said, via Facebook Live, farewelling Command Sergeant Major Counts and his family as he transitions and retires 30 years of great service. It was a great opportunity to send another uniformed soldier off in good fashion with adapting and overcoming to what we are working with. With that being said, my wife Tabitha and my children will be joining me soon. And we look forward to continuing to build on this opportunity and learn the community of Alabama and Redstone. With that said, I'll pass it back over to you.
All right. Okay, and rather than me opening today, thank you, Sergeant Major. I'm going to pass it off to Colonel Medor to give you a quick Fox Army Health Center update, and then we'll get started.
Hey, good morning, Team Redstone and families. Thank you for joining us today. It's always a privilege to address you, provide you some information, and when needed, answer some questions that might help you. First and foremost, as far as updates are concerned, we remain and are open for business. And specifically for military medical readiness, we have vision, hearing, your periodic health assessment screening still going on. So we ask, as you've normally done, schedule those by calling over to Fox Army Health Center to come on in and get those squared away for you. Also, acute appointments are open. We have a number of providers slotted each day for acute appointments. As per previous guidance from MedCom, Department of the Army, and the Defense Health Agency, all future appointments were taken off of our docket, so to speak. So everything now you see are acutes only. The good news for that is I have a number of providers open for those acutes each day, and that allows you that opportunity for same day or the next day, if you will, to get that appointment that you need. Again, we remain open for business. Got a couple of other updates I'd like to make you aware. Screening, you've seen some previous telecast from Colonel Smith and myself about screening and coming into Fox Army Health Center. As you might be aware, and as a precaution to not only my staff but you as well, we screen everybody coming into the building. And that's a quick process. We've been doing that now for 2 weeks. You've seen some of the walkthroughs on previous videos. Just a reminder to you to build a little bit of time into your schedule if you're coming over for an appointment to come on in. It's a very quick process. Even if you screen positive, happy to say you're still going to get either the treatment or the service, the appointment that you came over to get. And I'll talk about pharmacy in here in just a second. But suffice it to say, when you come over to Fox, even if you screen positive to come inside, we're going to get you the service and the treatment that you need. Drive-through pharmacy, today, 26 March, is day 4 of our drive-through pharmacy. I'm happy to say it is up and running. We have been updating the process throughout the week as we try to make that as fast as possible. I'd ask you to refer to our Fox Army Health Center Facebook page or our .mil to see about the diagram if you haven't been through our drive-through yet. Our diagram shows you which entrance to come in, because in essence we loop you around the facility to ensure we have a good flow when you come up to the roundabout to process through. As a reminder, the drive-through is for refills only. We continue to catch up and work through some of the backfills for the refills we were trying to do when we had to close for a few days within the pharmacy alone. But again, I'm happy to report the process is working well. We're going to make it better. As I've seen and conversed with some of you on our pharmacy drive-through line, I appreciate your patience and your understanding. We are in a new norm as we continue to combat COVID-19, and part of us and our ability to push as much foot traffic outside the building is why we need to go to that drive-through pharmacy. Most of you know and have been into our waiting area in the pharmacy. It's a bit tight. Although there's enough seating in there for a lot of people, it's too close. And in an effort to push a bit of business outside the building, we've opened that drive-through pharmacy for you. Now, next week, Monday, 30 March, for new prescriptions only, you are able to come inside for that, but as a strong reminder to you, that's just for new prescriptions, because again, we've got to keep as much foot traffic from the pharmacy side outside the building as possible and to get you to the drive-through. I think for the most reports and one-on-one conversations I've had with customers, the drive-through pharmacy, they've been pleased with the experience. You get to stay in the comfort of your own car, and with that, I would like to make a bit of a plug-in about inclement weather. Unfortunately, I will have to make a weather call sometimes about the drive-through pharmacy. We had to make one this week on Tuesday. We had some significant storms in the area. Tuesday morning, there was lightning in the area, and we had to close that drive-through capability for just a few hours. In that regard, please stay tuned to our Facebook page. We will keep that updated real time as close as we can. So just because we may be closed in the morning does not mean we'll be closed all day. And we'll make that weather call throughout the day. Again, I do have a number of staff outside the building, and I got to continue to protect them. You'll also notice my staff are in PPE. And I tell you that as for you to not feel uncomfortable. In our precautions these days, and for my staff when they're engaging with you outside the building, through the drive-through pharmacy, through the screening area, they are in PPE, they're in masks, in some cases gowns. Please know that's just a precaution. We're still treating you with the great service you've come to expect and find at Fox Army Health Center, and it's just an added precaution to keep the staff protected and you as well as we handle either your ID card or prescription bags and bottles throughout that process. Today, we will initiate a new contract for a testing capability. I'll be sending a note to all the leaders here on Redstone about that new testing capability as the contract begins. For you and us, that means a quicker turnaround on testing time. Some of you have asked questions out to Fox Army Health Center personnel about testing. There is a protocol to be tested. We do have the capability. Our current capability is there's a long turnaround time for results in that regard, and thanks to Army Contracting Command and their team and General Pardue, we have a new contract here with a local vendor that's going to get us a turnaround time of less than 24 hours. So that's great news. And again, a note to follow to all the Redstone leaders about the testing process and procedures here going forward. We've had a number of individuals talk about our phone lines. I will tell you, last week with our pharmacy and various operations, our phone lines last week were maxed out. As of this week, all reports I've received are that the phone room and our individuals with the phones, we're not seeing any issues. I would ask you to please comment on our Facebook page or send us in comments if you're continuing to have issues with the phone for call-in. We've had double the capacity of employees on my part to answer the phone. So I think in that regard, this week anyway, the process has improved, but I look to you for some updates here going forward if you're continuing to see any concerns or lags or the phone for whatever reason disconnecting on you there with any Fox employee. As with everything, I look forward to seeing you over at Fox Army Health Center. I look forward to seeing you through the drive-thru. And again, please come online with us with any comments or with our patient advocate if there's anything you see we could do better for you at Fox. And appreciate everything you do. Thank you, sir.
All right. Hey, thank you, buddy. Okay. So I'll open up with a few comments. And I'll tell you that quite a few of the questions that you've have already been answered. So as I bring up those questions, we may repeat ourselves a little bit just to make sure that we're getting to the crux or answering your question specifically. But please pardon us for that. Okay, so from Redstone Arsenal's perspective, the Arsenal remains open. We are executing mission essential task requirements at every tenant organization here. As you all know, Redstone Arsenal performs a myriad of critical missions for the federal government, as well specifically, the DOJ, NASA, and then of course for the Department of Defense, that being the Army as well as Department of Defense entities. As you know, the Army and DOD recently issued an order that asks us to directs us to transition to an elevated health protection category. I'm happy to tell you that Redstone Arsenal has already been in placing those precautions that allowed us to be preemptively prepared for that. And so what you've seen up until today have already put us in a position to fulfill those requirements. You may read that as HPCon Charlie, which to the public doesn't really mean much. But I assure you today that Redstone Arsenal has already achieved those through the precautions we've already put in place. Those precautions required or directed all of our organizations on the installation to minimize the number of personnel that we need to bring here. That is to ensure that we execute mission essential tasks, but at the same time move our employee workforce back to their homes where they either conduct telework or they execute what is known as administrative leave. Those precautions are executed by the individual tenant commands. As they continue to reduce the workforce they have on the Arsenal, the tenant commands are doing that for us. And we've gone from approximately 44,000 that work here each and every day to somewhere less than 19,000, which is what we get the reports. So today, or last week, we were up near 50% or 60% of the personnel working on the Arsenal. Today we're probably at 40%, and we will continue to reduce that. This is all in effort to enforce social distancing and encourage you who are at home to protect yourselves and protect our workforce. Limit the number of people that can become infected by good social distancing and limiting how often we come in contact with one another. The additional precautions that you saw take effect yesterday as Redstone Arsenal, because we've reduced our number of personnel coming on the Arsenal, we were able to close 2 gates. We closed Gate 3 and we closed Gate 10. Both of those gates, we've successfully moved the traffic probably to Gate 1 and to Gate 8. And we have been able to adjust our guard manning that allows us to put guards in reserve in the case that guards become sick in the future. We'll have guards to replace that and be able to continue our essential functions. But once again, we've removed additional people from the potential pool of the virus. Likewise, our Child Development Center and School Age Services, we're operating at less than 50% capacity. And so we have consolidated the 2 CDCs into one. So Goss Road children have been moved to the Mills Road CDC, and the children in the Goss Road School Age Services have moved to the Mills Road CDC, or the Mills Road School Age Services. We've effectively consolidated those and continue to provide you the mission essential support. We'll watch your mission essential children in order to ensure that the mission. You might have noticed that we closed the Java Cafe, we closed the eatery at the bowling center, we closed the eatery at the golf course, and we closed the Firehouse Pub. However, the cafeterias, the MWR cafeterias in all of the major facilities remain open for takeout only, and the AFES eateries, vicinity of the PX, and our Martin Road Express, those all remain open for takeout only. We recognize we still have human services to provide for those who come to work. All of those are in order to set the conditions for improved or the increased HPCon, but allowed us to posture ourselves and reduce the number of individuals potentially to come in contact with the virus. Now, what I'd like to do is to move on to a couple of the questions. And so rather than to go back over a couple of the things I've already said, I'm going to push this first question over to our Department of Operations. I will pan the camera while I read the question. The question is, as a responsible cyclist that tries to ride to the right, I'd be more willing to ride on the shoulder, but there are all kinds of debris and road tires aren't cheap. I know that they haven't been cleaned in over a year. With all the construction, there is an increase in road hazards. Can we get a street sweeper to run the shoulders and then maybe once per quarter or so? So I'll have Mr. Ron Thomas for the Department of Operations answer the first question, and then I'll pass it to the DPW.
Good morning, sir. That's a great question, and I think there's a couple of facets that we probably need to acknowledge here. And from the DPW side, our DPW does a great job maintaining our roads and grounds and facilities across the installation. So our roads are probably provide one of the safest environments for our cyclists. And as you know, we've got a very large cyclist community here, and it continues to grow. One of the things along the side of that is our LE and our fire and our responsible vehicle operators continually report any hazards that might be on the road, and then again DPW responds accordingly. I think regarding a street sweeper direct question is we have limited resources available, so while we are taking care of the primary roads and the surfaces with those street sweepers, that street sweeper also has an additional service capacity in as much as we have an airfield that is very important. We keep that clear for all of our air traffic as well. Additionally, I would remind you that within the scope of the Garrison bicycle policy, we recognize that a cyclist should be treated as a vehicle, and as a matter of fact, we would prefer that you ride on those roadways. Riding on those roadways would probably significantly reduce your encounter of a hazard that you might be talking about, of a stray nail or rocks or loose dirt, loose gravel, loose materials along the side of the road. So I would ask that while we probably don't have full capability to clean the sides of the roads, our primary focus is take care of those main roadways, and we would encourage you to ride in that main roadway and provide yourself the safest riding environment that you can. Sir, subject to your questions or anybody else's, I'll turn that back over to you.
Okay, let me actually defer that over to DPW, and we can talk about the street sweeper operations.
This is Joey Skinner. I'm with the Director of Public Works. We are very limited on the resources that we have, especially when it comes to street sweeping. We have one street sweeper on the installation. As Mr. Thomas had mentioned earlier, it is used quite a bit at the airfield to ensure there's no debris on the air taxiways or the airstrip itself. In addition, as there are issues that do arise with hazards on the roadways, that street sweeper is prioritized to go and take care of those. When those things are not occurring, it is on a scheduled rotation across the arsenal. We're basically broke out into 6 different zones across the installation, and that street sweeper moves across those zones. And so some roadways may not see the sweeper on it, but once or twice per year, just depending on how that year goes and the utilization of that single street sweeper. And that's all I have, sir.
Okay. Okay, so there are quite a few preset questions that deal with HP Con Charlie and what is HP Con Charlie. And I'll direct you to our forward-facing website that describes HP Con Charlie in a word picture. What I can do is I can best answer is that our job as in HP Con Charlie is to do our best to limit the number of folks, personnel, who need to come to the arsenal. And we're doing that through your individual tenant commands. They are identifying those persons who need to be here for critical mission essential jobs. And then we are looking at it from the Garrison standpoint, are those people that need to support those critical mission jobs. Otherwise, the precautions that you've already seen, which are meant to limit unnecessary foot traffic, have already been put in place. However, it's important to understand that there's not a set checklist on what those are. We implement precautions as necessary as we begin to see a behavior from the public or from the workforce that we need to adjust. And I assure you that we meet 3 times weekly with the leadership on the arsenal, all of the tenant commands, to ensure that our precautions are already put in place. But it's important to understand that there is not a set checklist and that we are moving through the health protection categories in a manner that we best think supports both the mission but preserves and protects the workforce. So that covers quite a few questions. One of the questions that just came up is how can the community help? And both myself and Colonel Medor have expressed since the beginning of this is that the best way that the community can help is by ensuring that each of us observes our own personal health. We wash our hands. We stay out of personal contact, or 6 feet away as best we can from other individuals and not share personal space. And that we observe good personal hygiene, good social distancing, and most importantly, for those of us who do go home to telework and do go home in administrative leave, is we go home and we minimize our traffic with anyone else outside of our homes. The intent is to reduce the number of people we all come in contact with each and every day through our work lives and our normal lives. And if each and every one of us observes that, we can help to combat COVID-19. But that is the best way that our community can help. The next question I'm going to pass on to is I'm going to go to our housing office. We had a question, and I'll go ahead and read it, but I've got Mr. Patrick Haas representing Hunt here, as well as our housing director, which is Mr. Ray Zapata. The question says, I live at 502 Walnut Avenue. I maintain my yard, front, side, and rear grass. I seed, fertilize, and take care of the yard. Yet little children run through my yard, leaving trash, toys, and broken sticks, all sorts of debris on their way to playing in the big tree behind my house. Can I say something, legally say something to these children to keep them off my lawn, or can housing or the military police say something when they see them beating the tree with a baseball bat? And I'll pass it on to Patrick.
Thank you, sir, for the question. That's a good question, and that is actually addressed in our resident handbook. So if you would like to reach out to us at the housing office and we can get some further details from you, that is something that we can support and definitely take action on that. Our phone lines, the 256-430-1517, you can still call that number, and that will get routed over to one of us in the office, and we will be able to call you back.
Okay. All right, the next question I'm going to pass over to Colonel Medor. The question is, why was it deemed too dangerous for military personnel to remain at the veterinary clinic and work, but part-time civilians are ordered to work with no precautions taken? Who can close this office?
Hey, thank you, Kels. Great question. So all of your veterinary clinics through the continental United States fall under what are called public health commands. You have 3 regions in the United States: West, Central, and Atlantic. Here at Redstone Arsenal, our veterinary clinic falls under Public Health Command Atlantic, which currently resides in Fort Meade, Maryland. As you know, or most of you know or are aware, that Here in the past 2 weeks, there have been a lot of recommendations and prescribed guidelines to commands to make max telework available to various employees throughout their commands. With respect to our veterinary clinic here, I can tell you we are open for business, as they have a dual-hatted mission of not only servicing resident and enrolled pets and animals here for various individuals, but also food inspectors, as they continue to inspect shipments that arrive to our commissary here. Now, having said that, some individuals, by way of the commands, were deemed to need to execute telework options, and in this case, in few instances, that has happened, but I'm happy to report we are open and continue to maintain operations. Thank you.
Okay, thank you. Okay, so our next question I'm going to pass over to our Department of Operations and specifically the game warden. But the question is I haven't seen anything posted, or I'm sorry, turkey season starts Saturday, 28 March for Madison County. Will we be able to hunt on post during this turkey season?
Great question for those of you that are great hunters, and especially the turkey hunters. You wait for this year to year. Unfortunately, we will not be able to support our hunting programs here on the Arsenal, as we're restricting that function. This falls into a non-mission essential category. Our folks at Outdoor Rec do a great job of supporting the hunters as you're on the conservation installation. But in compliance with all of our guidelines, social distancing, reduce our non-mission essential hunting to the minimum. This is one of those areas that we chose to address, and we look forward to you coming out and fishing and getting ready for the next season, whether it be deer or duck hunting. But hopefully we'll be able to have a very successful turkey season going into next spring. Sir, any other guidance on that, or I think we're good?
No, thank you very much.
Great.
Okay, the next question I'm going to pass over is I'm going to pass this to our Human Resources Office. So Teresa, the question is, could you please give insight as to how long you think the one-stop registration for DMV will be closed?
That's a good question, sir. The DMV is closed until further notice. To renew or replace your vehicle registration, you can call Madison County Call Center, and we can provide those numbers later to you. Or on your registration form that you receive in the mail, you can there's a mail-in address for that. That's all I have, sir.
Okay. All right, so I'm going to take a question that just came over Facebook, actually 2 questions, and then I'm going to pass it over to our child care personnel just to give you a quick overview on the child care facilities. And the question really is why are CDCs and the school-age services still open? As you know, we have mission-critical personnel on the installation. And as a soldier serving in faraway places, I've been able to serve because I've known that my family is protected and safe. And as so long as my family is protected and safe, I feel capable of performing the mission that the Army's asked me to do. Here on Redstone Arsenal, our CDC employees are doing just that. For those mission essential personnel that must come to the Arsenal each and every day, we want them to know that their children are taken care of in the best manner possible. And so our CDCs continue to remain open in order to ensure that that care is provided. There's a question is there a plan for screening people coming into the CDC? I would like to tell you, go ahead and come back here for a minute.
Oh,
Yes,
sorry.
I would like to tell you that we could establish screening at each and every location on the installation. But frankly, that is not a possibility. We rely on you, and this is where the community can help us, is we rely on you. If you are sick, don't come to work. And if you're sick, please don't bring your children to the CDC. If you have a cough, a dry cough, if you have a runny nose, if you have a fever, a persistent fever, if you're having difficulty breathing or you feel short of breath, then we ask you to please stay home. we ask you to do that, take your sick leave, and go see your primary care provider, whether that be at Fox Army Health Center or that be within the community. But that assures us that we don't have the potential of bringing that sickness to our child care centers, to either your children or those essential people that need to care for your children. And we can keep that pool healthy and continue to provide the service. I would also tell you at this point is if you have come in contact with someone you know to be positive of COVID, it is probably in your best interest and the Army's and your communities for you to self-monitor and take a day of sick leave until you can get the opportunity to go and see your healthcare provider and confirm that you do not have any symptoms. And then again, knowing that you don't have those symptoms and you're fine, is then go ahead and resume work and bring your children into the CDC. However, most importantly, we rely on you to best diagnose yourself, and if you think you're at risk, then to take that day of sick leave or go on admin leave, and please don't bring your children to the CDC. Now, I'd like to go into I'd like to ask Mr. Andre Terry to go into what we're seeing at our CDC and how we are conducting operations there.
I can tell you right now, sir, that we've been really vigilant in making sure that the facilities are clean. We've gone over and over through the guidelines that's been disseminated in regards to the requirements for health and sanitation and anything that Fox has put out to our program. The biggest thing that I can tell you in terms of the children and the staff is we're following those guidelines, and we're definitely watching to the T if there's any signs or symptoms of children having any of the symptoms that we've learned or could be interpreted as having anything to do with COVID-19. In regards to screening children, right now it's all done visually and based off of those symptoms. But as the commander said, I can only reiterate, if your child is sick, then we ask you please don't bring your child in. A lot of it has to do with the integrity of the community. And at the same time, the old adage that it takes a village to raise a child, at the same time it takes a village or a community to keep our children and families safe. So again, if you see any of those symptoms, we just ask that you don't bring them in. We'll be vigilant in the child care centers to make sure that we're doing our part, but it's going to take the community to keep everybody safe.
Thank you very much, Andre.
Yes, sir.
Okay, we have a myriad of questions that deal with discussion of PII and HIPAA. So first and foremost, I want to assure you, the workforce, that when your chain of command is asking what you consider, asking you information that you consider PII or HIPAA, I need to assure you that your chain of command is asking that for your specific health. If you identify yourself as potentially having symptoms, they want to report that to Fox Army Health Center so that Fox Army Health Center can determine how best to help you. And in turn, Fox Army Health Center does not report your PII or HIPAA information to the installation, but what they do is they let us know how many people are in self-monitoring or how many people are in quarantine. What that allows us to do is ensure we understand where or how many potential people are affected on the arsenal so that we can identify whether additional precautions need to be made. But I'm going to go ahead and pass this over to Colonel Medor, who'd like to discuss the difference between PII and HIPAA information.
Okay, thank you, Kelsey. It is a great question, and we've talked a number of our patients and constituents here on the Arsenal about PII and HIPAA, and especially when your chain of command or your leaders are asking you questions you feel are personal to you, and well, they are. And give you a couple of examples as we try and look at this from an installation perspective. And we want to use COVID-19 as the catalyst for this discussion, because really what we're looking at from the installation is a public health narrative for the Arsenal. And as all of you know, we have a number of different commands, tenant organizations here on the Arsenal: Department of Justice, FBI, ATF, and of course the NASA Workforce, Marshall Space Flight Center and a myriad of other commands, joint commands on the arsenal in here. So we have a requirement to ensure our senior commander and senior mission commander have a good snapshot about the health of the force, and that involves everybody. And often, and again using COVID-19 as the catalyst for this, often individuals, maybe when they're asked or queried, feel a bit uncomfortable about that, and that's, again, absolutely understood. Personal identifiable information in the case of COVID-19 is a person's name and their being positive for the test. That is PII. In the chain of command and for leaders here, that is protected and is held as such. Why we look at the difference between something that falls under HIPAA, which might be a diagnosis, your height, your weight, your name associated with that. We usually like to see the three categories which fall under a HIPAA category. We are making decisions here, the chain of command, the installation leadership here, based on readiness and the health of the command. So holistically, when my public health nurse or my preventive med nurse reach out to you, who are registered nurses, to talk to you about your health, one is to help you, but also to keep the roster as accurate as possible. And in essence, it's just a very simple list of who's on quarantine and who's tested positive. And I can assure you that is very much protected, it's encrypted, and it's to ensure that our leadership have a snapshot daily of the health of our population. Helps inform them for the decisions they may have to make, as you've seen here of late, and of course you've heard General Daly speak as well, our senior mission commander, as that relates again, as he sees Redstone Arsenal. PII, again, in this regard, your name with a COVID-19 positive status is PII. No matter what, for what information your chain of command may offer to my staff, it is protected. It will remain so. And what I will tell you for those out there who are ill or currently under COVID-19 positive, we wish you a speedy recovery. And for most accounts, as we've talked to our patients out there, it's a illness to run through, to get over, and we wish you the best and a speedy recovery from that. But please know your information is very much protected by us as we ensure our leadership have a good snapshot of what the installation looks like from a holistic perspective.
Thank you.
Thank you.
And while we're here, we just had a question come up on the live stream that that talks COVID-19 in patients. So I'll ask you the question, another one that just came up.
Sure.
Is, if someone is confirmed positive for COVID-19, how long do they have to stay in isolation, and what are the procedures for them to return to work?
Absolutely. That's a great question. And I'll answer it from the perspective of you being a DoD civilian or active duty. Right now, the guidance from the CDC is 14 days after your last symptom. That's after your last symptom if you're COVID-19 positive. Now, for healthcare personnel, that's a different category. HCP, short for healthcare personnel, it's 7 days past your last symptom, because today in our battle against COVID-19, it's absolutely critical for our healthcare personnel to have them at the ready. But for all individuals, for your last symptom, that could be any one of those symptoms, whether it be the fever, the cough, the dry cough, or the runny nose. Again, you want to make sure that last symptom is over. Your healthcare provider is the person you want to speak with to be your release authority, if you will, to come back to work. It's really like any other illness you have, or you're sick, you've recovered. Maybe you'd like to call or get in touch with your provider to say, hey, this is how I'm feeling, I feel pretty good. They're going to have some questions for you about how long it's been and diagnose you, maybe sometimes over the phone, and say, you know what, we think you're okay to go back to work. I will tell you the default is your healthcare provider in this regard, and especially for those of you out there who don't see us, who are not enrolled to Fox. It will help you out immensely in speaking with them, as they are your best guide.
Okay, thank you very much. And before I move over to a series of questions for our Department of Public Works, I've received a question that says, how has COVID-19 affected the commissary's food supply? So that's an interesting question, because I'm going to be a little snarky, I guess. COVID-19 itself hasn't necessarily affected the commissary's food supply. It is those of us that use the commissary who are affecting the supplies. We are receiving regular and routine deliveries. However, upon the initiation of COVID-19 detection within Alabama, you'll notice, whether it's Publix, Kroger, or the commissary, the amount of supplies on the shelves has dwindled. And that is a response to our shopping habits. So today, across Alabama, it's very difficult to find toilet paper. It's difficult to find flour and some of the long-term foodstuffs. But I am assured that we are continuing to receive our regular shipments, and that as your food supplies get stocked at your homes, we will see a return to regular stockage levels on the food shelves, as you won't have the necessity to go out and bulk purchase. What the commissary has done here on Redstone Arsenal, as well as the AFES facilities, is we have put a limit on your shopping habits at this point. So you'll notice that when you do go into the commissary, there will be a limit on the number of cleaning products that any one individual can buy, or the number of packages of toilet paper that one can buy. Those items that we see disappear from our shelves have been limited as far as the number that you can purchase at any given time. And that is to ensure that we have enough to go around, so that when someone is actually missing those supplies at home, that they have the ability to pick them up. But I assure you that as we stop stockpiling at our homes, the inventory levels at all of our commissaries, at all of our grocery stores will return to normal. That's the best way for me to answer that. I will tell you that additionally, we've asked the commissary to take into account our most vulnerable customers. And those customers are those that meet our CDC criteria of either immune deficiencies or age, and those are our most vulnerable customers. Here at the Arsenal, that includes our retiree population. And so we have asked the commissary and AFES both to observe retiree hours. Both of those hours are posted routinely on our forward-facing website. But we ask all of our active duty folks and our additional customers who are not retirees to allow our retirees in there, and to not bring our kids to the commissary during retiree hours or to the PX during those hours, in order to allow our most vulnerable customers to shop and then make way for the rest of us. And we assure you we're limiting what each and every person can actually take from there. Now I'm going to ask to move this over to the DPW, to our Public Works, and I'll ask them a series of questions that have been coming in. So first question concerns itself with Gate 9. And when will the far right lane exiting Gate 9 be open for traffic? It appears to be finished, however, the barriers still remain. So Joey, if you could expand on that.
Yes, sir. It's a great question. I know we have a lot of traffic that utilizes Gate 9, especially exiting the Arsenal. There are two portions of that roadway that have been currently barreled off. One of those portions has been opened back up recently. So the very southern portion near the new development, it was closed off as they were putting in a concrete flume along the ditch line. That work has now been completed, and those barrels have been moved to the edge of the roadway. But as you travel further north, as you're exiting, there is a section of roadway that is still barreled off, and the reason for that is that the proper control system at the intersection as you head north has not been installed yet. So there are the proper equipment, the traffic poles that will have to be put in place with the arms that hold the traffic lights. Those are on order, and right now we're still several weeks out for receiving them, and it is yet to be determined how COVID-19 across the nation may have an impact on when that equipment is delivered. But once it's delivered, those arms will be installed along with the proper traffic lights, and once everything is safely operating, then the lane will be opened up for access.
Okay, Joey, an additional question that came in that's DPW related, and that is, how are we disinfecting or cleaning the work areas?
Yes, sir. We have an industrial hygienist professional that works closely with us, looks at the Centers for Disease Control's website and information that they provide. That information is looked at regarding what is the suggested areas that should be cleaned and the products to be used. So our contractors use those products as recommended by the Center for Disease Control, the CDC. We take those products, again, using them in those areas that have been determined, whether it has been an individual that has been identified as having COVID-19 that has been in that area, or whether or not it may be someone who has come in contact. So in addition to that, I know there's concern just across the arsenal with regards to facilities and common areas that are being utilized by the folks that work here on Redstone. The custodial staff that we currently have are, because there are fewer people here, there's some less essential tasks that they do on a daily basis, such as vacuuming the carpet, cleaning the windows, things like that. And we reprioritize their effort to focus more on the common touch point areas within those facilities. A large portion of that is the door hardware, so whether it's entrance ways into the facility itself, to the stairwells, the elevators, things of that nature, break rooms. The custodial staff that are already in those facilities are now focusing more of their time touching those areas and cleaning those to help, again, to prevent the spread of COVID-19.
Okay, so what I think I heard you say, Joey, and correct me if I'm wrong, I just want to make sure that we're being clear on this, is the RSA cleaning staff, the contractor that we use is very familiar with the CDC and OSHA policies that are being developed particularly to combat COVID-19. And they are applying those cleaning, or those techniques and those cleaning types specifically to ensure we're meeting those requirements on a day-to-day basis. And then that Redstone Arsenal currently has 3 different types of cleaning that we perform for the different tenant organizations. And those are common cleanings, which may typically have included additional items like window washing or vacuuming. And we have, with our partner, reprioritize those efforts to ensure that we are hitting common touch points consistent with the CDCs. So the daily cleanings that your organizations are encountering are well within the CDC guidelines. And then we have what's known as an enhanced cleaning, which is an additional group of individuals who come in, and they will be requested by your organization should your organization come up with someone that has determined they need to go into quarantine based on a potential contact. They're not symptomatic, but they believe they may have come in contact, and so they go into a self-monitor or quarantine, and that organization would ask us for an additional cleaning. We'll bring in a separate team to do that. And then finally, the last one is what we call a disinfection, and that is where a known COVID-19 person has been at work, and we are going to bring in an additional team over and above that conducts the disinfection. Okay, and they'll clean all of the areas that person was in. We call that the trace areas, and so we'll conduct a trace and go and disinfect those trace areas, and that is a special team, and that's requested by your organization and is certainly provided for, and we have the capability here at Redstone. In fact, we've already done it multiple times. So thank you, Joey, for answering the question. I think we're getting close on time, and so I'm going to pass one more question over to our Human Resources section. And please pardon me as I find it. Oh, and that is CAC renewal. Is CAC renewal still open?
Yes, CAC renewal is still open. Starting Monday, the 30th of March, we are going to appointments only and emergencies. Emergency is considered your pin reset. Your CAC card's going to expire within the next 30 days, so CAC's still open.
All right, and if I'll expand that a little bit more. Is at Redstone Arsenal, we will not, if your CAC card has expired for 30 to 60 days, Redstone Arsenal will still honor your access to the installation based on your CAC or retiree and NASA or DOJ card. We realize that the limited access to updating those cards is affecting the public, and we will still bring you on so that we can either update that card, for you, but we will honor an extension of 30 to 60 days until we can adjust. Additionally, I'd like you to know that the Army, IMCOM, the Army, AMC are all working to extend the expiration dates across the Army. Most important to understand is your CAC ID or your retiree benefits card are directly related to your ability to interact with healthcare. And we understand that if we're unable to renew your CAC ID card in a timely manner, that may be affecting your ability to receive benefits, whether that's at AFES or the commissary or at a TRICARE facility. And so the Army is already working that, and we hope to see a solution soon. But until then, we will make sure that if your ID card is expiring, we can get you an appointment and we can get your CAC ID updated. Now that's unfortunately all the time we have today to answer your questions. We'll continue to take questions through Facebook or email over the course of the remainder of this week. We'll do our best to get them posted through the week, and this video will be available should you want to take this video and pass it on to a friend or a coworker to ensure that they're getting the most accurate information that we have today. So I encourage you to share. I encourage you to help us educate the public so that we can reduce the anxiety, and more importantly, so that you can help the remainder of the workforce understand that your leaders for your tenant organizations are already in compliance with HP Con Charlie, that we are putting in place all of those precautions necessary to continue to protect the workforce while enabling our mission essential functions. And that's all I have, but I'm going to give last word to Colonel Meador, and then I'll pass it over to Sergeant Major Jimenez. But thank you very much. I appreciate you tuning in.
Quick admin note, just to trail on a couple things that Colonel Smith said. Drive-through pharmacy hours are 8 in the morning to 3 p.m., Monday through Friday. Again, ask that you continue to look at our Facebook site as well as our .mil webpage for updates in case inclement weather we should close it temporarily. But please know we are working to maintain services, all services at Fox. We look forward to seeing you out there, and thank you again for your comments and updates as we continue to go through this. Thank you.
And Sergeant Major.
Thank you very much, sir, all the professionals in here, and everybody watching via Facebook Live. Great questions that were coming in and comments. We appreciate everything that was put out today to continue to inform our public and our community. This is a new way of doing business, but it's a great way that we can continue to inform you guys out there and keep us going with what we got, and that's taking care of people and accomplishing the mission that we need to accomplish. Thank you very much.
All right, and then the final word is, I encourage you, these are great venues, and we appreciate our ability to inform you. I would just ask you to ensure that for those of us who work here on the Arsenal and who are at home, whether it's telework or it is in administrative leave, I encourage you to stay in touch with your chain of command. Ask them for the information. I know they have just as much information as I do, but it is each and every one of our jobs to remain as informed as possible. Please don't wait for us to tell you. Please get to our website and read what we have to say. Please interact with your chain of command. There is not a reason to be anxious because the information is there. Thank you very much. Have a great day.